Louise says he wants to take a hot shower to ease his pain.
All right.
But then, Dan watches as his brother's condition takes another bizarre turn.
Mini unit, because it's only 1
On his
hour
way into
point.
the bathroom,
So I'm gonna
Louise vomits on
record
himself.
as much as I can, get through as much of the
And
points that I can.
then
to
he
make sure
proceeded to
whatever I
get
don't through with
even
my
more ill. He
I'll record
threw
it,
up
so like after
3,
this
maybe
little
4
1
times.
hour point
So I go to
unit
check
will be
on him,
done.
and then he just
Chapter
collapsed.
13, it's what is
He was
infection?
unresponsive.
What does that word mean?
We don't know what's
What is
wrong with
infectious
him, and
diseases?
we didn't know what to do.
What does that mean?
My dad
And epidemiology.
decided, let's take him to the hospital.
Tracking diseases. What
Dan and his father
what
pick Louise up and
organisms
take him
cause
to the
what
nearest
diseases?
emergency
Where
room.
are they? How are they
I was
spreading?
panicked.
How do they get from
I had
one
no idea what
individual
to
another
expect.
individual? There's a lot of terms. It's a big
When Dan told me that his brother had collapsed, I felt, my heart in my throat. I was scared.
As we go through it. So it's
At the hospital, Dan watches helplessly as Louise fades in and out of consciousness.
He woke up for just like a little bit. He was kind of talking in a way that didn't make a lot of sense. His words were garbled.
So the PowerPoint goes through
The emergency
what is
room staff's first thought is that the young man might have overdosed.
Living together. Your normal flora that we'll talk about.
But a
We've already
toxicology
talked about
screen of
normal flora
Louise's
already. We're
blood
looking at
finds
normal
no
flora
drugs in
all
his
the time
system.
with these. What are opportunistic pathogens? What are reservoirs?
It leaves the
for
medical staff
infections?
concerned that he could be
What
suffering
is
from a
infection?
serious
What is the
neurological
nature
condition.
of infectious disease, meaning
So
you've
they
got
order an
infectious
X-ray of his skull.
infection. What happened? Where did
They
it
found
come from?
that
What's
he had
kind of the
an
next
immense amount of
sequence
pressure built up in his
timeline,
head.
which can all vary depending
They
on
said it was
what's
around 3
What are
times
modes
more
of
than
disease
a normal
transmission?
person
What are all the
has.
different ways you can
Louise's
pick up
doctors say
different
the
organisms
compression
and
is
get
being
sick?
caused by a
And then
condition
what
called
is
hydrocephalus.
epidemiology? Tracking of the different diseases.
Hydrocephalus is a buildup of cerebral fluid in the
We're very
brain.
fortunate because we know most of this already.
The mounting
Someone had to
pressure
do all the
cuts off
research
blood
knowing
flow
what
and can be caused by
disease,
traumatic head
what are all the
injury,
signs and
infection,
symptoms that
or
go along
tumors.
with different diseases.
But the source of Louise's
So starting
condition
off,
is
just
still a mystery.
the fact that we are living with a whole bunch of organisms is symbiosis.
With Louise
So
in
again,
critical
symbiosis
condition,
means
his case is
organisms
taken
are
over
living
by
together.
neurologist
Sometimes it's
Dr. Soren
beneficial,
Single.
living together.
When I first
sometimes
saw
it's
Louise,
not.
he was
The symbiosis
close to
just means
being
organisms are
dead
living
from brain
together.
herniation.
Dr. Single has an idea about what might be causing
Symbiotic
Louise's hydrocephalus.
relationship means everyone
The
benefits.
suspicion
It's
was that there was an
mutually beneficial.
obstruction somewhere along the
We have
path
organisms,
of
part of
that
our normal flora
cerebrospinal
that are
fluid.
living in your intestinal tract
To confirm
right
his
now.
theory, a
They're
CT scan
benefiting
is
because
ordered.
you gave them a home and feed them every day.
There was a
You're
small
benefiting because they keep
bright
other
object
potential
at
disease-causing
the site
bacteria
where the
at bay or
cerebrospinal
out
fluid
of the
usually
area.
leaves
So they're
the
benefiting
center of
you.
the brain to go
You're-
down to the brainstem.
They're benefiting you.
An obstruction
and
of this part of the brain
they're benefiting
is
from
often a tumor.
Everyone wins.
In order to take a closer look at the object,
Relationship is
Dr.
that you
Single
also have
uses an
organisms that are
MRI,
living on you right now.
and the
A
results are
commensalistic means
distressing.
one organism benefits and the
The
other one
MRI
is
scan
affected.
of Louise's brain
So you have
showed a
organisms,
cyst
all the
of
bacteria that are all
water-filled
over your skin. We
structure
you saw how many
which had the
bacteria
shape
were on
of
your
a
hands.
snowman.
Some of those could have
And
been
inside that
disease-causing,
cyst,
depending on
we
what
saw
you touched before we
a tapeworm.
swabbed your hands on that first lab. But
The pork
most of those
tapeworm,
bacteria,
also
even your
known
normal
as
flora
Tinea
bacteria that live on your skin,
infects both humans and pigs.
they're there. They benefit.
Inside
You gave
Louise's
them a
brain,
home,
the
but
tapeworm
they really
sits
don't
in a
cause you
protective
any
cyst.
harm. A lot of them don't do
As it
anything good
grows,
for you.
the cyst
They
blocks
just,
the flow of
they're
fluid
there.
around the brain,
So
causing
they
a buildup
benefit,
in
you're
pressure
unaffected.
and leading to
Parasitic
Louise's crippling
relationship
headaches,
means organisms
confusion,
that are living in
and
or around
loss
the
of
body.
consciousness.
They're benefiting because you gave them a home and a place to live
I
and
was
grow.
completely shocked
But
that
they
he would
cause some
have a
type of
tapeworm
harm.
in his
These
brain.
are the
I
ones
mean,
that can cause disease.
who actually ever
So any
expects
type
that?
of parasitic relationship
It's
is
not
someone
something that occurs
getting
on a daily
harmed. Any
basis.
disease-causing
So
organism is
it
considered
is
a
definitely
parasitic type of relationship.
one of those situations that are the most unexpected reality or real moments that you're ever
This
going
is
to
just showing
experience.
examples of some of the ones that are found in you. Again,
Most people
mutualistic, everyone
associate tapeworms with the intestines,
Bacteria in your intestinal
but
tract.
tapeworm larvae can
Things for
also
you.
get into the bloodstream.
And
When
they
that
benefit
happens,
the
the
staph
larvae
on your
protect
skin,
themselves from the immune
mental.
system by
You're
encasing their
not
bodies in a
benefiting,
hard,
but you're not
impenetrable
harmed.
cyst.
They're benefiting
Sometimes
because
those
they have a
cysts
home.
find their way into the
Any
brain,
type of
where they
disease,
become lodged in
so
cerebral
tuberculosis is
tissue,
an
causing
example.
seizures,
Causes the
paralysis,
disease.
and even
But
death.
any organism that can cause disease is considered a parasitic relationship. They benefit.
And then
at the
Dr.
expense.
Single has even more bad news for the family.
Now, you guys
Since
do
the
have
tapeworm is
organisms that are
located
living
in the
and
center
around
of
the body.
Louise's
We define
brain,
this up in lab.
removing
Your
it
normal flora.
could kill him.
Again, Bacteria that are living in and on the
One
body for
has
your
to be
entire life.
very careful not to
Normal flora do
rupture
have
the
other
cyst,
names.
which could
Sometimes it's
then
called normal
dislodge the
microbiota. Sometimes
tapeworm.
it's called indigenous
Once the
microbiota.
worm
I don't hear
escapes,
indigenous all that
there
often,
will be
but I
no
hear
way
normal microbiota
to retrieve that worm,
quite a bit.
and it may
Means the same
actually
thing.
take the patient's life,
Other
ultimately.
names, different textbooks, depends on who's talking about them.
That's not something you
I
want.
generally just call them normal flora. It's
Not for
easier to say
the
than normal
bratty kid
microbiota.
brother that you love to death that you pick on.
Again, bacteria
that
that
you
are
look
living in
for.
and on the body your entire life.
That you literally
microbiome-
protect like he's yours.
Oh, write it up. Microbiomes, where do they live in the body?
A few hours
What's the
later,
location?
Dr. Single begins the
So the
risky
microbiome
procedure.
is, okay, we know they're
The
living on
tool we use
in and on the
is
body,
a
but where? Are they living on your
neuroendoscope,
skin?
which is a
Are they living
camera
in your
and a small
throat? Are they
forceps
living
on a
your teeth?
very
Are they living in
small
your
but very
digestive
long
tract? You know, the
tubular
microbiome
instrument.
is where
Advance the
specifically are
camera
they living in or on
and
your
working
body?
tools
Their
through the
home
skin,
is
through
the
the skull
microbiome.
bone, and into the center
Now,
of the
of
brain.
the bacteria that are living in
Dr.
our
Single
body
slowly
our
moves the
life,
endoscope towards the
we
cyst,
group them into two types.
conscious that
The
one wrong
resident
move could
microbiota
end Louise's
and
life.
The transient microbiota.
I then
which
utilized
is
small
Louise's
forceps
life.
to
Your
work
resident
the cyst away
microbiota,
from the brain structures.
These generally are the ones
Once
we
I
talk
had
about when we're
trapped
just talking about
the
your normal
cyst
flora that do good
against the
things, don't
endoscope,
cause you harm.
I carefully removed the endoscope
Things that
while
generally don't
holding
cause
onto
any
the
kind
cyst.
of issues for us.
The endoscope
They
came out
generally
of the
don't
brain
cause us any issues.
in one piece.
They're just hanging out with you. They've taken up
Without breaking
residence
the cyst.
in or on your body. They're living there. Most are commensal, meaning they don't
It was
benefit
just
you,
the best
but they don't
possible
harm you.
situation
They're
to the
just
worst
there.
possible situation in the world.
I'm going to give you examples of what kind of
And
bacteria
I'm really
are living
thankful
in
that
where
it
right
turned out
now.
the way it did.
You've got a lot of bacteria living in and on your body right now. Again, you even know because they don't cause you harm.
The
they
next
don't cause you
day,
good.
Louise's
They're
cranial
there.
pressure has subsided, and doctors
This-
are
I
able
don't
to
even
bring
know
him
if
out of the coma.
It was going to be tiny. This is
When
just
he
showing
woke up,
examples of
it was
some
like
of your
every Christmas
residential
you've had, the time you were
microbiota that
born,
are
all
living in and
compiled
on
into
your
one
body
moment.
right now. So these
I
are
remember
the
waking up,
organisms
not knowing
right
what
now
was
that
going
can be
on.
living just in your
They
upper
told me what
respiratory
happened and how
tract.
it came
Lots of
about,
different
and I was just kind of
organisms. There's a whole
surprised that a
group of
tapeworm
different
was
types of
lodged in my brain.
organisms that are living in
And
your
by the
upper
time they
digestive
found out,
tract.
I was probably
a
like
bunch
30
of
minutes away
organisms
from
that are living
dying.
in your lower digestive tract. Two different
Most people
environments.
contract the tapeworm
pH
after
is
eating raw
different,
or
food
undercooked
source is
pork,
different,
but there's
enzymes are
another way to
different,
get one.
between your
When
upper
an adult
digestive tract and
tapeworm
lower
reaches
digestive
maturity in the
tract,
intestine,
that
it begins to
some
lay
may
eggs which are
repeat
shed
and
through
can be
the
found in both
feces.
environments,
If
but
an
some are
infected
very
person
specific
uses
in
the
what kind of
toilet and
environments
doesn't
that they can
properly
live in.
wash their hands,
And it keeps going.
they can spread
There's a whole bunch
tapeworm
of
eggs to
organisms that are
everything
living
they
in your
touch,
female,
including
urinary
food.
reproductive tract. There are a bunch
They
of
told
different
me I could have
organisms that
got
can be found in the
the
male
tapeworm
urinary
from eating
reproductive tract.
unwashed fruits
Some
or
of the
or
organisms are
salad I ate
similar,
that
are
wasn't
not
properly
sex
washed.
specific, but some are. The environments are different. Different
Today,
organisms
Louise is grateful to
live
be
in
alive
different environments.
and for the
And then
support
there's a
of his
bunch
loved
different
ones.
organisms that right now can be
I'm really
living on
lucky.
your skin. You saw
I had a
some
room
of them already.
full
You swabbed
of
your
my
hands.
family
And
every
then there's
single
some that
night I
can
was
be
at the
living
hospital.
in the
There was not
conjunctiva of
one
the eye.
day that
So again, these
the
are
room
your
was empty.
normal residential
Even though my
microbiota
brother
that are
doesn't
living
like
in and on the
it,
body.
every time I see him now, I walk up and give him a hug.
So when you're thinking, oh,
He
I'm
may
gonna
fight
leave
it,
alone,
he may act
you're not,
grumpy, but I
'cause you've
think
got like
somewhere
billions
down
of
inside he kinda
microorganisms
enjoys me
living
giving him a hug.
in you and on you, and they're depending on you to make sure that you're still there and providing them a home. Lots of organisms. Now the transient microbiota, these are ones that are picked up somehow, and they live on.
Peter
they live
Haggerty
on
is
there, and
29
I'm like
years
in
old.
lab. I put the
He
quotations
lives in
around
Salem,
the short
Oregon, where he works in a
periods.
paint
Like, oh,
store.
what does that mean? Maybe
In
they're
his
in
spare
or on your
time,
body
he enjoys
for
the great
hours,
outdoors of the
weeks,
Pacific
days,
Northwest.
years.
I like to go out and
But they're
snowboard
not
in the
in
wintertime.
or on your body for your
fishing in the
entire
summer.
lifetime.
You got the beaches, you got the forest, you got the deserts. It's
They're
awesome.
found in the same regions as your resident
Peter is the
microbiota.
youngest of 4 children
Some
and remains close
can
with his parents,
potentially
Peggy and
cause
David,
disease,
who live
so
nearby.
pathogenic, meaning they can be
I think being the
disease-causing.
baby, he's very special because we've spent a
But
lot
they
of
don't hang out
quality
in your
time
body your
together, just him and I
entire
as he's
life.
growing up.
Peter is hardworking. And he's
Some of
very
the reasons why they
conscientious.
don't hang out with you.
I'm very proud of the man that he
forever.
has become.
One is that your residential
But
microbiota
one tragic event has
will
come
kick
to
them out.
define their family.
Like they've literally taken up
Our
resident, and
oldest
there's only
son
so much space.
passed away last summer,
and they've
and it really
staked
was
claim
a traumatic
first,
experience
and they will
for
inhibit
all
any
of us.
other organisms from growing.
After losing Matt, it was
Sometimes these transient microbiota don't hang out on the
I was
body.
in
That's
shock.
because of them.
Still kind of all
because
fresh on our
something in your
minds.
body itself may change.
It's a very
And I'm like,
hard
your pH may
situation,
change
and we
for some
shared
reason.
it together.
Maybe you
So
got a
I think
fever,
that
now your
has
body
brought us
temperature
closer
changed.
as
That
a
might be
family
just
group.
enough to inhibit those organisms.
But
it could be
something is
something
going to take
simple
this
as
family
you
back to the
wash your
brink.
hands or wash them off if they're on a surface area. But I'm like, something in your body may change or shift a little bit.
It's
Your
a cold
immune
winter's
system
night in
may
January, and
that
Peter is home
itself
alone having
eventually
dinner.
kick them out. Your immune
was
system's kind of like
biting and taking a
sometimes
big
look at
bite into a big
organisms that, well,
burger.
they're not causing any issues,
First
so
bite
they're not
just
alerted to get rid of them.
struck a
But then
nerve,
something will
and
trigger
I
your
was
immune
just like,
system
"Ooh,
of, okay, they've been there long
it's
enough.
not good. You know, that
Now we
really
need to
hurt.
get rid of them. But they don't hang on
The
you for
tooth
your
really was kind of bugging me. I figured it was something I could probably manage. I
Where do
had
you
to just
get your normal
chew strictly
flora?
on the right.
because you were born.
He
the
tries to
womb
ignore
is
his tooth
sterile.
pain, but it doesn't go away.
But you still have to pick all these organisms up. Again, I had
So
all
Peter
those things.
goes
You
to
get
see his
stuff living on
dentist.
your skin, in your digestive tract, in your respiratory
They took
tract.
x-rays,
Where do
and
you
then they also
get
came
that?
in and looked at the
Well, your
tooth.
womb is exenic or
So the
sterile.
x-ray did reveal I had an abscess
So
tooth.
the first place you start to pick up some of these normal
A tooth
flora
abscess is a
the
pocket
birthing
of pus
process.
that sometimes
the fact that
develops
there
from a
are
cavity.
normal flora in the female reproductive
So they wanted to do a root
tract,
canal and then
that's where
just
some of
kinda
the
cap
first
the tooth.
bacteria are picked up.
It was going to take 2 to 3 weeks.
Now, they've done
But it
studies.
wasn't
Your
a
normal flora
dental
can do
emergency.
really good things for you. So
And
for people
I was
that
happy
don't have
that we were
natural
actually gonna get it
childbirths
taken
and
care
have
of.
C-sections, they're now already like, okay,
meantime,
well, how can
Peter
we get some
takes
of the normal
pain
flora
relievers.
from the female reproductive tract in contact with the skin of that
2
new
days
infant?
later,
And
Peter
they're
is
looking
getting
at those
ready for work.
benefits that
I
could
went
be
into the
lost.
bathroom to kind of start shaving. and
Otherwise,
my
the
face
first
is all
month,
swollen.
first years of their life, these are my kids. First month, first years
wasn't a little
of
bit
the
of pain.
kids' lives. That's
The
where
floor
they're
of my
picking them
mouth
all
was
up.
so swollen
Anyone
that
that's touching the
it
baby,
was level with my
talking with
teeth.
the baby.
It was
kids, you know,
freaky
they put
looking.
everything in their mouths. They touch everything,
But
put it in your mouth.
I wasn't too
Some
worried
of those
about it. I figured it
organisms
was
might
just,
become part of their normal
you know,
flora. Some
the
of them
dental
could be
issue.
disease causing. You know,
But
it's like
Peter's family
try to
won't
keep
let him
our
off the
kids
hook so
clean, but,
easily.
you know,
When I
they're
first saw
constantly
him,
picking up different bacteria
oh my
that
gosh,
could be good
something
bacteria.
is not right. I suggested to
Once
Peter
they
that
pick up all the
he
normal
should
flora,
go back
those
to the
organisms
dentist.
hang out with you,
But
in you and
I
on
told
you
him,
the
you
remainder
don't need to
of your
be
life.
concerned
To
or
try to
worried for
keep
it.
infants and
Like you
kids
usually
in
are.
a sterile environment
When
can
Peter
actually do a
said
disservice
that, I
to
realized
kids.
I needed
a lot
to
of
step
parents are like,
back
oh my
and let
God,
him
no
take
one can
charge
touch
of
the
his own
baby.
life.
Which I get it, you know.
But I got anxious.
vaccinated, you could be potential spreaders, but I'm like, no,
Peter
one can touch the
carries
baby.
on with his
Everything has to be
routine.
sterile. Told, you know,
But a few
everyone
days
holding
later at
babies with
breakfast,
gloves. You know,
it's
I'm
clear
like,
that
it's
something more serious is
how to
going
keep
on.
baby in a sterile environment can do them a disservice because
My
those
throat was closed
normal
up.
flora
Like it wasn't
can
as
be
big
very
as it used to be.
beneficial.
Like it was swollen.
And I'm like, those normal flora can
I couldn't
prevent
get food
other
past my throat.
potentially disease-causing bacteria.
It was really hard to
And if they
swallow
don't have
things. And when
them,
I
they
did, it was really, really
potentially get
painful.
More sick. So keeping
was
infants
just
in a
miserable,
sterile
really,
environment
you know?
could long-term make that infant sick.
And when Monday rolls around,
Again,
Peter
I'm one
heeds
of
his
those
mother's
that's like,
advice
yes, you
and
know,
heads
what
right back to the
keep
dentist.
stronger.
The
However,
dentist office
and I'm
opens
like,
at 8. I
obviously
was
there
there
are some
like
diseases that
8:10.
you want to keep away from.
I went in and asked
Get
if
an
I could get
established
my
disease.
procedure done sooner than 2 weeks. It's just,
Now, opportunistic
Just do this
pathogens. So an
but
opportunistic
it couldn't fit me in the
pathogen-
schedule.
However, the
Is a
dentist
normal
does give
flora.
him a passing glance.
She seemed really busy at the time. She just kind of came over. She didn't even really look at me. She just went behind the counter
that causes
and wrote the prescription for me.
She hands Peter a prescription for an antibiotic.
I figured it was just something she'd seen before, which was kind
bacteria
of
that are living on your skin, that are living in
reassuring,
your
I guess.
respiratory tract, your digestive
Peter
tract.
takes the
Again, they
antibiotics for the
should
swelling
be
in his
there
throat.
either commensalistic, not causing any harm.
A few days later,
or
he's getting up
they
to go
could
to
be
work.
beneficial to you.
I was
but
checking myself out in the mirror, just looking at everything, and
they can
noticed
cause
the swelling
disease.
had gone
That's
down
when
in
we
my
call them
mouth, but now
opportunistic.
it felt like there was a
So,
small
how
cut
does a
right
normal
behind my
flora
tooth.
that's not normally disease
And every time
causing
I kinda touched
now
it with
gone
my
rogue
tongue, I felt
and
like
causing
something was
disease?
secreting out of
Usually
it.
one of three things. The first one is usually
I
the
figured I was
most
getting better,
common.
and that was
is
part
that
of the
normal
body's
flora
process for
bacteria
the
goes
healing,
somewhere where it's
you know.
not supposed to be.
Peter goes to
So
his
if it's
job
found
at the
in an
paint store.
unusual site in the body,
But there,
it can
the
cause
cut in his
disease
mouth
there.
is affecting his work.
so when it's in its normal
It felt like it was
microbiome,
secreting
what's
every
supposed
like
to be
10,
found
15 minutes,
in
and
its
it would
normal
just
location,
fill in my mouth.
it doesn't cause any issues. Can even
The
be
color
good.
was- it was really
Goes somewhere
brown,
else.
and it
now
stunk.
disease causing.
It was like
Super
if you had
common
a bunch
example.
of vinegar
You
in
have
your
E.
mouth.
coli in your digestive tract
So
right
I
now
would
that helps
carry
break
this
down
cup with
food.
me everywhere,
That's a
spitting into it.
beneficial
Everybody was
bacteria
like, "Oh
in
my
your
gosh, what's
digestive
wrong?"
tract. But if E. coli
Customer
that's
came
found
up
in your
and
digestive tract
while
gets
we
into into
talking to
your
them,
urinary tract, what do you
spit
now
would form in
have?
my mouth. It's nasty.
You have a
tasting.
UTI.
So I'd spit
And
it
E.
out.
coli, again,
I said, man, you look
could
bad. You
be
should
in
go
the
to the hospital.
digestive
And I
tract.
said, hey,
bad. When
believe
it's
me,
in
it's
the
under
urinary
control. I've
tract,
got it.
it has now gone rogue. And it's not
I just
because
try to
it
power through
wanted
it.
to be. It's a bacteria
However,
that was your
Peter's
normal
boss
flora.
tells him to take off early and get some rest.
And it's in that other area that it can cause disease.
3 days later, in the dead of
If you
night,
become
something
immune
jars him from his sleep.
suppressed, again, your immune system can
I did a
kind
little
of keep
burn.
your bacteria, your
And as
normal
soon as
flora.
that kind of got up into my throat,
There's only so much
literally like
space. Everyone
closed up.
behaves. But if you were on
I was
immune
gasping for air.
suppressants,
Like,
and it happens a lot, people that are going through cancer treatments, other types of treatments, they're
scared.
given immunosuppressant drugs.
I ended up going to the
And I'm
bathroom
like,
and
now if your immune
staring
system
at myself
can't
in
keep
the
your
mirror,
normal
like,
flora
just
under
willing
control,
myself to
now the normal
take a
flora
breath
can
of
start
air.
to grow uncontrolled, causing
I just felt
infections. Or
I was dying.
if there's a change to your
I'd
normal
say about a
flora,
minute or so of not
again,
breathing.
your
I finally
good
was starting to
bacteria
take a breath.
can keep other bacteria in check.
And at that time, I
C.
was
diff
like,
is an example.
something is
You've got
seriously
normal
wrong.
flora. Again, some of you may
Peter
have
calls
C.
his
diff in your
parents to take him
intestinal
to the
tract right
hospital.
now, and it's part of your flora. All your other bacteria
But
are
when they
keeping
reach
it in
his
control.
house,
There's only
they
so
notice
much food.
something
There's
very
only so much
strange.
space. But if you change
Immediately
your
when
normal
he got
flora,
into
you
the
took a
car,
broad spectrum
I
antibiotic
said,
that killed
"Peter,
all the
you
good
reek."
bacteria. C. diff's hard to
smelled
kill.
like
It's one of those
decayed
endospore bacteria.
meat.
He
You change your
stunk
normal
to high
flora,
heaven.
makeup,
Kind of grossed me
other
out. I was
bacteria
like, boy,
start to
that's
grow
just
uncontrolled.
awful.
And so I'm like, if you start
make
to
a
change
beeline
up
for
the
the hospital.
ratios,
There,
nothing's
the
getting
on-call doctors
out of whack.
examine him.
It's not
The doctor
under
had a little
control
stick and
anymore.
he's pushing down,
Those
moving my
normal
tongue
flora
around.
bacteria can
And I'm watching him,
lead to disease.
and I see his eyes get really big. All of a sudden, he goes,
Now, reservoirs of
and at this
infection.
time, I'm looking
A
at my
reservoir
parents like,
infection
oh,
is
something's not right.
No, probably have my example.
They told us that it was basically a swelling
it's the
due to an
location.
infection and that it was closing up the windpipes. Now we knew that this was really
Of
serious.
organisms.
I started to become concerned.
It was quite overwhelming.
Where they have the potential.
To stop Peter's throat from swelling shut, doctors put Peter under with a general anesthetic and insert a breathing tube into his lungs. Then, the doctor consults Peter's parents.
And I'm like,
He told us that the
if you
infection
got
definitely
sick,
had gone down
where did it
into
come
the
from?
throat. I asked the
like,
doctor
oh, I got food
point
poisoning.
blank.
Oh, where'd it come from?
So
Food.
Peter's
I'm
going to
like,
be
oh,
okay.
I've got the flu. Where'd it come from? Oh, that
And
one
he
person
looked at me and said,
And it's one of those, I'm like, if you
Honestly, I
get
can't
sick, it
tell
had
you
to
that
come
right
from
now.
somewhere. The somewhere is the reservoir infection. Where is the organism
Peggy
hanging
and
out
David Haggerty's
that it then
son,
is then
Peter, is in
somewhere
the
where it can cause
ICU
disease?
and suffering from a mysterious infection
There
that
are
has
three
caused his
types or
throat
three
to close up.
groups of reservoirs.
we were definitely
Animal
praying,
reservoirs, which we'll talk about, these are my next 3 slides.
panicking, and
Non-living
praying,
reservoirs and human
worried about whether our
carriers.
son is going to survive or not.
So animal reservoirs,
Unable
there are
to treat
lots
the
of different
condition, doctors
diseases that we
medevac
can
Peter
pick
to a
up from
specialist hospital
animals.
50 miles
any
away.
kind of disease that is originally found in an animal
There, head
that
and
then
neck
gets
specialist
transferred
Dr.
to
Ritter
humans
Sansoni takes
is
on
called
his
a
case.
zoonotic disease or a zoonosis.
So when Peter came in, he
Again,
was
when you think the word zoo, I'm
sedated
thinking you're
and pretty
imagining
sick.
animals. So a
Our
zoonotic
biggest concern
disease
was
means
whether
it
or not
comes
the infection
from an
had
animal
spread
source or an
farther
animal
down into his
reservoir.
chest.
To save Peter's life, doctors rush him into the
There
OR.
are different routes of infection before it goes from animal
We had to do everything that we could
human,
possibly do
it
to
makes sense.
keep Peter
One
alive.
is direct contact with the
Once we
animal
cut into
or
him,
waste
the
products.
team identified
so,
basically
hugging the
dead
armadillo.
tissue.
Or,
was obvious to us that he
petting
had
a random
something we
dog.
call necrotizing
or,
fasciitis.
picking up some type of animal waste
I'm
product.
going, what in the heck is
Again,
that?
that's interacting with the animal or the waste
Necrotizing
product. We can get
fasciitis
different
is a
illnesses.
flesh-eating disease
By eating
caused by the bacteria
animals, especially
Streptococcus and
meat.
Peptostreptococcus.
That's what undercooked meat is. You're eating animals,
Inside
and if
Peter's
it's not
body,
cooked properly,
the
there are lots
bacteria
of different
attack
types
the
of
tissue in his
bacterial
mouth
diseases
and
that
neck,
we can
cutting
acquire.
off his blood supply.
Certain strains of E. coli.
As the bacteria breed, they release
again, we can
harmful
pick up different
toxins that
diseases.
cause his brown spit,
And then
putrid
blood-sucking
smell, and
arthropods,
tissue decay.
aka mosquitoes and or ticks.
Doctors quickly inform the family of
Mosquitoes
the
we
news.
normally think of more
Necrotizing
often,
fasciitis offers a grim
although
prognosis.
Ticks, we'll talk about tick-borne diseases
People
as well,
often die of
this
organ
semester,
failure
but blood-sucking arthropods,
if not treated
there
rapidly.
are diseases that when a
a
mosquito
flesh-eating
bites an
bacteria, and
infected
that's where I
animal
went,
and then it bites us, it can spread diseases.
We were very
West Nile
scared,
virus is
very
a
concerned for
mosquito-spread
Peter.
disease that infects the mosquito,
What makes the
picked it up from an animal,
Streptococcus
then it
bacteria
bites
so
us and
dangerous
spreads it.
is that they
Same
have
thing,
a kind
malaria.
of cloaking
It bites
device.
some infected
They can cover themselves with
animal,
a protective
it
shield
doesn't always
that makes it
come
hard
from
for
an
the
animal.
immune system to recognize them as a threat.
And then bites another person.
This allows the bacteria to
A tick,
spread
what's
within
a
the body and
tick-borne
infect
disease
vital
around
organs.
here that comes
Up
from
to
originally from an animal?
40% of
Lyme
all
disease.
cases
And I'm
lead
like,
to
that
death.
tick had to feed
For
off
4
of an
long
infected
hours,
animal. It
the
doesn't always have
surgeons
to be
struggle
you.
to cut out the infected
but it has to
flesh.
feed off an infected
During the
animal,
initial
and then
surgery,
it
the
feeds
team
off
removed a
us, and it
significant amount of the
spreads
dead
disease.
tissue,
And so
basically
animals
from
are
his
the
mouth all the way
original
down to his
source, but
collarbones.
we pick it up.
But there was
from
more necrotic tissue that was still
or
left
we,
over.
we pick up these different
Doctors
animal
complete the
diseases
first
from
of
eating
what will
under
be
disease
multiple
or direct
surgeries.
contact. Now, usually
Yeah, we
humans
lost one
are
son.
dead-end
I don't think we
hosts.
could deal so
I mean,
quickly
once
with
we pick
a
up
second.
that disease, we don't spread it from
In the
human to human.
ICU,
So
David
if I
and
pick up
Peggy
Lyme's
find their
disease
son with a
from
4-inch
a
hole
tick,
cut out of his
can
neck.
I now spread Lyme's disease to you?
Just like, oh my
Generally
gosh.
not.
It
And
was
I'm like,
looking
we
at an
generally are like,
anatomy
okay, well, I'm
picture.
going to
You
have a
could see
tick
the
feed on me
throat,
for a
the
while
esophagus,
I'm,
you could see all the
not treating
musculature.
Lyme's disease, and
And
then
it
I'm
was
going to take
like
that
a
tick, I'm going to put it on
big,
someone else.
ugly grin
It's
all around
very
this
unlikely
way
we're
here. It
considered
was just
dead-end
huge.
hosts. Rabies
As a mother, I
is another
couldn't
example
look
of a
and see
zoonotic
that much
disease that if you get bitten
damage.
by an animal,
It was
we can pick
extremely
it up, but
shocking.
we then aren't spreading rabies. We don't go running around
The
biting
medical
other
team
people and
performs
spreading
2 more
the virus.
surgeries,
So
but
we're
they
generally
manage to cut
considered
out
dead-end
all of the
hosts.
infected tissue.
Now, difficult to
The
eradicate.
doctors must place a tracheotomy tube in
It's
his neck.
almost impossible to get rid of
Peter
zoonotic
survives
diseases.
the horrific necrotizing
So,
fasciitis.
for example, if I'm just looking at rabies,
He has many
how would we get
guardian
rid of
angels
rabies?
watching
We get
over him.
rabies from the bite of certain
Maybe even a
infected
brother.
animals in the wild, whether it's bats,
Something to help you that night.
skunks, raccoons. Some of these are the more common ones that can
He
spread
put
it.
his finger over
How
the
would we
trach
get rid
tube
of
and he
rabies?
says, "Hi, Mom and Dad."
Like eradicate
And it was
rabies.
just,
Kill all the
it was
animals. Is that going to happen?
it was neat.
No.
Humans often have
I was gonna say, but-
streptococcus and peptostreptococcus in their
Vaccinate them all.
mouths.
And I'm
Most of
like,
the
it's
time, the
difficult
body
to
can fight
eradicate.
off
We
these
can't get rid of them all. I
although
wish
they
we could
can
get rid of all
cause
of them.
tonsillitis and other easily treatable
But
conditions.
we can't.
However,
we can't get rid of the
in
animals.
very
We can't get
rare
rid of certain things. I'm like, we
if these
can't get rid of all
bacteria
these
enter the
different zoonotic
bloodstream,
diseases.
they can cause this flesh-eating
Another
condition.
reservoir on
In Peter's
non-living.
case, he had
So
an
again,
infected
the
tube that
fact
allowed the
that
bacteria
water
to spread into the floor
or
of his
soil
mouth.
or different food sources.
Those
different,
survivors of necrotizing fasciitis are more susceptible to infections. This
water,
doesn't get in his
soil,
way.
and food, we can pick up different infections.
And today, after receiving a skin and muscle graft from his
Now
chest
that we've
to
got
close
into
the hole in his
summer
neck,
months,
Peter Haggerty is returning
water,
to a
you're
normal
going
life.
Swimming into certain
My voice
beaches.
is definitely
They
deeper.
monitor these different
I
water
lost my beautiful
sources
singing
for
voice.
certain bacterial
It's a little more
diseases.
grunge.
And I think just this last
got my family,
week they
got my
closed
work,
the beach down
got
in
my health.
Tonic, because its bacterial levels
Life
were
is
so
good.
high. Again, that's considered a non-living reservoir. It's like if you go swimming, you
Necrotizing
are putting yourself at
fasciitis
risk
is rare,
of picking
with
up
fewer than
certain
1,000
diseases.
cases a year reported in the U.S.
So if you are
The
drinking
best way to
infected
prevent
water,
infection is to make sure that
so if
any
you're like, I don't eat
open
dirt.
wounds are promptly
well, if you
and
touch the dirt
thoroughly
and didn't wash your
disinfected.
hands before you went and ate something,
If a
later.
wound does become reddened or swollen,
and I'm like, and
the
again,
CDC
I'm like,
recommends seeking
there's lots of different
immediate
diseases
medical
that can be
attention.
found in soil. Now, where the water got contaminated, where soil got contaminated, is usually fecally contaminated. Even the water that closed down the beaches and the Shawnick, and again, they monitor it all summer long, it's usually fecally borne bacteria that's causing those high counts.
It completely freaked me out.
Generally not anything that's
is
not
going
animal-wise.
on?
Yep. And then the last
Victoria Sutton and
reservoir
Cameron
is
Lillibridge
that humans
live in
are
Mill Creek,
carriers as
Washington,
well.
20 miles north of Seattle.
Again, if you're like, I got the flu, where'd you
They're
get
a
it
young
from?
couple
Oh,
who are
so
very
and so
much in
sweet.
love.
Or so-and-so came to work
Cameron
the other
always
day,
keeps me
totally was
laughing,
sick.
and he's very hardworking. He definitely
We are
spoils
reservoirs
me,
as well.
so I'm
we
very
can easily
lucky.
be spreading infection
Victoria is
from one
more
person to another.
spontaneous,
You're coughing on them,
adventurous.
sneezing on them, shaking their hands.
We love to go on walks and
People aren't
have a
washing
nice
hands
glass of
enough.
wine together.
Now, we group
They met each
human
other at
carriers
church,
into two
and
groups,
religion still
symptomatic
plays a big
individuals and
part in their
non-symptomatic
lives.
or asymptomatic
I was working
individuals.
for a religious
Which ones
youth
are the scarier
organization.
group?
I love loving on
Asymptomatic.
people
If
and giving, and
someone
so
comes
together
to
we
class
just
and they
really love on our
clearly look
friends
sick,
and everyone around
you
us.
can kind of be like, I'm just gonna. and try to avoid them as much as possible. But if someone's asymptomatic,
summer,
they're not
and
taking any
Victoria's
precautions
working at her mom's
themselves
fast
to try
food
to prevent
restaurant.
any kind of spreading. You're not taking
I
any
was ringing up
precautions to avoid
customers,
them.
and
They're
I
kind of the
noticed that my
scarier
ankle was
group
swollen.
because they can definitely be spreading different types of
It was
infections
just
and
big,
have no
like a
idea
big
that they're even the
baseball.
ones that are spreading
I was
the
shocked
infections.
because I don't remember doing anything to hurt
Now,
it.
as we talk
I just
about
thought maybe
infections,
it's an allergic reaction or starting a
some
new job at my mom's
terminology and lots of
restaurant,
terms.
walking around.
contaminated.
I had an ice pack and tried to use that to keep the swelling down.
Contamination
Victoria
is
manages
the
to work the
presence.
rest of the day and then heads over to Cameron's house.
We were just sitting in the living room and I showed him my ankle.
Something's contaminated.
My ankle
And I should even
was
say presence of a
definitely
microbe,
red and
or
it was
say
just huge.
unsurfaced.
But Cameron barely gives Victoria's ankle a second glance.
I was
In
not concerned at all.
lab, we try to do everything we
Put some ice on it and you're good
to
to
try
go.
to decrease contamination.
Cameron convinces Victoria
we don't
not
want
to worry,
microbes on our plates,
and
contaminating
his strategy
them.
seems to work.
Again, that's on the surface.
After
But
a few weeks
we
of
don't
using
want
the
those
ice
microbes.
packs,
We only
the
want to grow
swelling
what
in
we
her
want to
ankle
grow, but we don't
disappears.
want the contamination of any other kind of microbe on our
A few months later, Victoria is putting on her makeup
Infection.
before a friend's party when she notices something's wrong.
Is the microbe
As I was getting ready, I noticed that my jaw was swollen. I was worried that maybe I was having an allergic reaction to something. It almost felt like I'd been stung by a bee on the
Because you
side
right
of my
now are
face.
contaminated. You have
I
bacteria
didn't want
all
people
over
to
your
see
skin.
my face like that.
Great. Again,
I
some
put
of those
a
are
lot
great.
of
Doing
effort
great things.
into
Flora.
looking
The
extra
problem
cute
is
that
if
day.
those microbes
and then
that are
to
on your
have
skin
face swollen, it kind
get
of
in the body.
doesn't matter.
And we're not
what you're
talking in
wearing
the
or
body as I'm
what
going to
kind
lick
of
my
makeup you
skin
put
and
on
now
your
well, it's
face.
in my digestive tract.
It looked
And
bad.
like if something's in your
I was gonna
digestive
say it
tract,
looked bad.
it's not technically penetrated your body. It's not in the bloodstream.
Victoria
it's
puts
not in
on
the
a brave
tissues.
face and
You know,
heads
that's
to the
considered
party.
as part of the lumen
It was
of your
just
digestive tract.
embarrassing
When we're
to look
talking
like a
invades the
chipmunk,
body.
basically.
It gets past that
Despite her
whole
embarrassment,
first
Victoria is
line of
able to
defense.
celebrate
it gets
with her
past your
friends.
skin. It gets past the digestive tract. It's
A couple of
invaded
days later,
the tissues.
the swelling in her jaw subsides.
An infectious dose.
But it's not long before the painful swelling
the
appears at yet
number
another location.
of
I remember
microbes.
waking up one morning and
requires
feeling that my right eyelid is swollen and
cause
getting up
disease.
and going to look in the mirror and seeing how puffy it is. I couldn't really move my eyes up or open that eye. It felt weird. Your vision's kind of impaired in the sense that you can't open your eye all the way.
As we go through different bacteria
I showed
and
Cameron.
viruses, when we get into those
He
specific
just thought it was something I was
units, we'll talk.
overthinking
Different
and
organisms
it
have
wasn't
different
a big
infectious
deal.
doses. Getting one
I thought she
potentially
just must be
rabies
allergic
virus
to
in the
everything
body
in the world.
doesn't mean that's going to cause disease. Getting one HIV virus in the body doesn't mean it's going to
She takes some
cause
ibuprofen,
HIV.
and the
I'm
swelling
like,
goes
getting
away
one
on its
particular
own.
E. coli in the body doesn't mean it's going to cause disease. Different
Several months
organisms
later,
have different
Victoria is helping
infectious
some friends
doses.
move into a new
You
apartment.
need
I
enough
was helping
of a
lift a
particular
box
organism in the
and all
body
of a sudden
for
I
it
just
to
had
actually be enough to
shooting
cause
pain in my
disease
hand.
to take hold. So I'm like,
It
different
felt
organisms
almost
have
like
different
my
infectious
bones
diseases.
were
We'll talk
rubbing
about there
against
are
each
some
other.
organisms that literally it just
It
takes
was
one.
just excruciating
As
pain.
one gets
I
in the
was
body,
completely
it will
freaked
cause
out.
disease, but that's pretty
Unable
rare.
to help her
Normally,
friends
you need a
move,
large
Victoria
enough
goes home
organisms
to
in the
ice her
body
hand.
to actually cause disease.
A few
And then
days
that
later,
can still
she
vary.
sees her
The
primary care
infectious dose can
physician.
vary among not just
She
the
took
organism,
blood
but also the health
samples
of
and
the
she
host.
examined
if
my
someone's
hands.
immunocompromised, the infectious
But
disease
after
number
all the
might be a
tests were
lot less.
run, they were all negative. I
Switching to
just
blue.
felt at a dead end.
My black's kind of dying.
I was really frustrated
Are
and
the
annoyed.
results
The doctor tells Victoria to wear braces on her hands,
of the infection.
but the pain still lingers.
So it got
Then
in the body.
something good happens in
It
her
got
life.
past that first one on the
Cameron
phones.
proposes
it got
to Victoria.
into the tissues.
I wanted to
You
be
are
in a
now
committed
infected.
relationship and
The
in
disease
the
is,
future
well,
have a
now that
family,
it got in,
very
what-
large family.
What's going to happen? What's it going to cause?
A few months later, Victoria is busy
now,
preparing for
morbidity
their
is
wedding.
a similar
I totally wanted a
definition
do-it-yourself wedding, and I was sewing some
It's
centerpieces.
just looking at not just
and
what are the
all of
results
a
of
sudden,
the infections, or what are the changes from.
I had to stop because my hands were in so much pain. It felt like the inside of it was on fire. It definitely made me annoyed
what are the
that I
changes?
couldn't
What
use
is it
my
gonna
hands. I was
specifically
frustrated,
do?
upset.
Specifically cause a temperature change. specifically
when she
cause
told me
the
her wrists
organs
hurt,
to fail?
I thought,
What are the changes?
here we go again.
Again, very similar. Obviously,
He was
put all the
annoyed
morbidity together, it's
about
gonna
hearing about it all the
specifically tell that this
time.
disease
He didn't
causes
have
all
an
these
answer,
different
and
things.
so it frustrated him that he couldn't fix it.
Now, for an organism,
I didn't expect him to be
cause
able to fix
disease,
the problem.
to
I just wanted
cause
him to
changes
listen.
in the body. Again, it has to go through three
I had
things.
fears that
the
I
first
was
is
going
it
to
has
have
to
to
get
live
in.
the rest of my life
Because it's not going to
handicapped
cause
and not
disease
being
if
able
it's
to
sitting on
do
the surface
things
of your skin.
normally.
It has to get
Victoria puts a halt
past
to her
that
sewing
external
and gets her
defense. It has
relatives to
get
help.
in. It's like I really should
For the next few months, Victoria's
then has to
mysterious
find a
swellings
home.
come and go.
Where is it going to live? Where is it going to stick?
On the
and then
day
it will
of her
start
wedding,
to multiply.
the swelling is
If it
mercifully
can't get in the
absent.
body, it's not going to cause disease. If it can't establish itself,
But a
it
few
can't
months
find
later,
a home,
Victoria
it's
is
not gonna
getting
cause
ready for the
disease.
day
And if it doesn't
when another
multiply,
strange symptom
it's not
hits
going to
her.
cause disease. Again, I really should switch my beads.
Just
see
had
around.
woken up
So it has to
and
get
felt
in.
something in my
it has
eye
to stick. It has to find home.
and figured it was just
and then
an
it has to
eyelash.
multiply.
I went to look in the mirror in the
The
bathroom.
different ways that it can get in. Portals of
when I looked in
entry.
my eye, I saw this long white
Now there are
stringy thing.
4 major pathways.
I saw
Again,
it start
lots
to
of different
move.
arrows, but 4 major
It was
pathways
kind
for
of
it to get in.
wiggling and
Can it get
squirming.
past the skin? These are my next 4 slides.
I was totally
Can it get
shocked
past the
and
skin?
freaked out.
Can it get past the mucous membranes?
It was
All
just
part of that
creepy watching
external
it
defense.
move and not knowing what
Can
it
it get
was.
past the placenta?
I just hear her pretty much
Or
scream
does
in
it
the
directly
bathroom,
get
like,
put in the body, which
freaking
is
out.
known as the parenteral route?
She says,
so again,
look
my
at
next
this,
4
like,
slides.
move.
So the first, skin.
And I'm just like,
If you have little lines, I fill them in. Your
Oh,
skin
boy.
is an amazing barrier at preventing organisms from getting in the body.
For
Again,
3
it's an
years,
outer layer of
Victoria
dead skin
Lillibridge
cells.
has been fighting a mysterious swelling
You're
that
constantly
keeps
shedding
recurring
skin
in different
cells,
parts
which is
of her
great
body.
because bacteria maybe are trying
Now
to take
she has
hold.
just
You're
seen
shedding the
something
skin cells and
sinister
shedding the
moving in her
bacteria with
eye.
them. That means bacteria have to get past all those layers.
Her doctor
It's
sends
not
her
just
to
one
infectious
layer of
disease
skin
specialist
cells.
Dr.
They have to
Robert
get past
Joy.
all those layers of skin cells.
I did a very thorough exam,
But
including
some
her skin
pathogens can
and
still
also
get
her
in.
eyes.
They can get through any
I was
kind of
concerned that there
opening.
was a parasitic infection.
If there's any
but
kind
at
of
that time, I
abrasion,
didn't know
any kind
which
of
parasite
cut.
it was.
And then
So we
openings,
ran
even
more
talking
tests,
about your
specifically
pores,
blood
are a
smears.
potential area for organisms to get in and cause disease.
Several weeks later, the final results come in.
And then there's some
We did
organisms that are
find
like,
something
well,
in the
we don't
blood
even need an
smear that
opening.
looked consistent with
We're just
a
going to go
parasite.
right past the skin. Some
Victoria
organisms
was
can
diagnosed with
burrow
lower
through the
lower
skin
worm.
and digest our skin layer.
I freaked
Again, that's their
out.
biggest barrier. They need
I
to
just
get in the
couldn't
body
believe it
and then
and
find a
didn't want
home
it
and
to
then
be
multiply.
real.
And so they figured out ways
Loa Loa
to
is a parasitic
how can we
roundworm.
get past it?
Inside Victoria's body,
That outer skin
the
layer.
worms move throughout her entire system, burrowing through her skin and muscle tissue, leading to the
showing an
swelling in her
example of
ankle,
one that can
hands,
do
and
that.
jaw,
And we'll talk
and
about this
ultimately to
organism
the
later.
infection of her eye. In fact, she is so infested with the parasites that worms are literally crawling
plugged in
out
my
of her
speaker.
body.
She actually started to develop some symptoms,
Have I turned-
which
ooh, I don't know how
I
loud
wasn't
this is gonna be.
expecting. She actually coughed up an adult worm.
What is that?
I was totally creeped out.
Here we go. Why does it keep going away? There we go. Really good show.
When Missy
Sometimes
Allen
it's still
was
on after,
scratched by a
after taking this
cat,
class.
she thought the small puncture wound on her breast would heal on its own. But instead, the wound has grown into a 2-inch long, itchy red shape that seems to be moving under her skin.
I'm in shock. I recognize that I definitely do have a foreign body that is very much alive living under my skin. I have a pretty serious problem.
Missy and her husband, Rich, make an appointment to see a dermatologist. When the doctor examines the growth on Missy's chest, he comes to a shocking conclusion.
He definitely sees a worm growing underneath the site of where the puncture wound occurred.
Based on the size and shape of the worm, and the fact that it is still moving, the doctor knows it can only be one thing: a hookworm.
Hookworms are blood-sucking intestinal parasites that have jagged teeth they use to hook onto the flesh.
There are many types of hookworms, each specialized for a different host. But if Missy has contracted a human hookworm, she could be in danger. When a human hookworm infects the skin, the worm excretes an enzyme that breaks apart skin cells, allowing it to burrow freely through thick layers of skin. From there, the worm enters the bloodstream and travels through the body to the intestine, where it hooks into intestinal tissue and gorges itself on blood. But if a hookworm reaches the vital organs, such as the heart or the lungs, it can cause severe anemia, malnutrition, and even heart failure.
Monsters inside me.
Yay! It's a great show after this class. Again, there are some organisms, example hookworms, that don't need to get in through an opening or cut. They can secrete those digestive enzymes and they can just burrow in. And we'll talk about hookworms later this semester when we get into worms. Another place that they can get in or past to cause infection is past the mucous membranes. So a little A&P refresher, the mucous membranes are the membranes that line the internal cavities that are exposed to the outside body. Example, your respiratory tract has a mucous membrane around it because you are constantly breathing in outside air, and so we line the whole respiratory tract with a mucous membrane. Your digestive tract is lined with a mucous membrane because, again, everything that you eat was outside the body and now we're putting it inside the body. It's a lot of potential area where organisms can get in. And so we line these areas in the body with a mucous membrane. The respiratory tract is the most common mucous membrane that gets penetrated to cause disease. You are constantly breathing things in all day long. And although we have a mucous membrane that lines the respiratory tract, a lot of pathogens have figured out how to get beyond that mucous membrane. This is why I'm like, people are, when you're in very close proximity to people and they're talking, if they have a cold or a flu or COVID or any of these different types of respiratory infections, they are breathing them out and then you are breathing them in, and a lot of those things get past the mucous membranes. Your GI tract, again, everything you eat, you put in the body. And again, all the stuff that you eat, is it sterile? Not at all. The stuff that you're eating is not sterile. It is like never sterile. And you're putting lots and lots of potentially pathogenic organisms in the body. Luckily, most of them don't survive and cause disease. Part of that is because of the pH change. Your stomach has a very low acid that's going to kill a lot. And even if it can survive the stomach and get into the digestive tract, we still have enzymes, we still have different pH changes that usually inhibit organisms. That doesn't mean things that you eat can't make you sick. Anytime you get food poisoning, it's making you sick. So there's still lots of things that you can ingest, and it can cause disease, but less compared to respiratory tract. I don't know why I had these swipe. And then the placenta. Again, things can get in the body. In theory, what makes mom sick does not make baby sick. The placental itself is a very effective barrier. There are very few things that can make it past the placental barrier. And we will talk about certain organisms today that can. And then these are the ones that they're most concerned about with pregnant women. It's because generally, if mom has the flu, baby does not have the flu. And I'm like, there's a very effective barrier, but there are some things that can get transmitted. We'll talk about listeria and toxoplasmosis and things that can get past that placental barrier into a developing fetus, depending on how much, what is it, where development can cause spontaneous abortions, miscarriages, birth defects, premature births, depending on what it is. Again, very concerned about those things. But again, there's a very small number of organisms that can actually make it past that placental barrier. And then another way we can get things in the body is we put them there. It's called the parenteral route. We deposit things into the body. Not always on purpose. We generally don't want to, but it happens. Examples, if you've got some type of a sliver, you literally are putting organisms into the body. There are pathogens on that little wood piece, and we just put them in there. if we don't sterilize with needle sticks, and I'm like, you could potentially be putting bacteria in the body. This is one of the big issues when it comes to any kind of surgery. We try to do everything we can to reduce the parenteral route. Because when you have surgery, you've literally opened up the body. You removed that first line of defense. And I'm like, there is no skin barrier anymore. Everything can get in, so we try to prevent putting things in there. Trying to keep everything as sterile as possible. Not always successful, but try to keep everything as sterile as possible and reduce that chance. Now, once they got in, so again, organisms have to get in the body. They have to evade the external defenses. Then they have to find a home. So they try to stick. And there are some things that can help different organisms stick. Again, they got to get in, they got to find a home, they got to stick, and then they can start to multiply. So adhesion is just the process by which organisms attach themselves to different cells in the body. Because when I say they stick, they're sticking to different organs, they're sticking to cells, they're sticking to different areas. Different things that can help them stick, they're just called adhesion factors. There's certain organisms has very specific structures. For example, this organism is called Giardia. We'll talk about it later. It has adhesive discs that allow it to suction cup itself to our intestinal tract. That's a super effective adhesive factor. Most bacteria use proteins. They're called attachment proteins that help the bacteria stick. That protein can help it stick to certain cells in the body. And I've got a zoomed in picture of that. So attachment proteins are much more common. Bacteria use them, viruses use them. And instead of just calling them attachment proteins, because again, proteins can be structural materials, proteins can be enzymes, proteins can do lots of things. To specifically say that this is a protein that's used to help it stick, we call it a ligand. So a ligand is the fancy term for a protein that helps something stick. And it binds to different host cell receptors, meaning that protein, that ligand, can only recognize certain cell receptors, which means certain viruses, when they get in the body, are only going to cause diseases in certain areas of the body because they can only stick to certain cells in the body. If we can somehow change or block that attachment protein from recognizing and attaching to a cell in the body, ultimately, we can stop infection from occurring. And it's one of our areas of research on what we're looking for. We know that the organism has to get in the body, okay, but then it has to attach. If we can stop the attachment, it can't cause disease because you have to get in and it has to attach. It has to find a home. So if we can block, again, we do lots of ways to try to stop things from getting in the body, but if we can stop them from attaching, we can stop diseases. So the inability to make those attachment proteins or ligands makes something avirulent, which just means not disease-causing. It can't cause disease if it can't stick. Here is a zoomed-in picture. This is showing, real picture, electron micrograph, hand-drawn picture. This is E. coli. Here's an actual E. coli molecule. On the outside of the E. coli, there are these little attachment proteins called ligands. And again, they're very specific for what that attachment protein can recognize and attach to. And it's specific for this sugar, this carbohydrate found on the surface of our intestinal tract. So this is showing the actual pictures of, here's E. coli using those little attachment ligands to stick to cells, the little microvilli, in our intestinal tract. And again, E. coli in our intestinal tract, depending on which strain, can still do good things. Certain strains do bad things. But if we can somehow prevent attachment proteins from recognizing and attaching to certain cells, we can stop diseases. One of the biggest issues we found out with COVID is that, again, the virus has ligands, it has attachment proteins, is the receptor. The thing that it was looking to attach was found on so many different cells in the body, which caused so many different signs and symptoms. Because some people with COVID, respiratory, was one of the big ones because that particular receptor on the cell was most common in our respiratory tract. But some people had GI issues with COVID. Some people had the smell issues with COVID. And I'm like, other people had muscle issues, muscle weakness. I'm like, the receptor, unfortunately, that particular virus can attach to was found in so many different parts of the body, which caused so many different types of diseases with one virus. Now, the nature of infectious disease. So we're just saying it got in, it found itself a home, it's now going to cause disease. When something causes disease, usually you go to the doctor and they're going to ask, what are your signs and symptoms? But those two words mean two different things. The symptoms are subjective characteristics of a disease felt by a patient. PT. What does a subjective characteristic mean, though? Yeah. It's like your own interpretation of something. What would be an example of something that they ask all the time that's a subjective characteristic? Pain level. Can you see pain or measure pain? No. What did they try to measure pain? Yeah, the smiley face score. You know, which smiley face score is your pain level? But that's subjective. What one person's 10 could be someone else's like, I've had worse, and someone else's 5. And I'm like, it's subjective. You can't see it. You can't measure it. It's a subjective characteristic. So pain would be one. What about another one? These are things you can't see, you can't measure. But I want to know more of like what's something you would feel. Such as? Like tired? What? Well, that still goes with pain in different ways to describe it. It could be. Can't measure if you're hungry. You can't measure you're tired. Can change mood. I'm trying to think of what else. I don't want to find my PowerPoint. I'll think of it. I feel like there's another one they ask all the time, but I can't think of it. Nausea? Can you see nausea? That's not how you spell it. It depends. If nausea turns into what? How do you spell nausea? Why does that not look right? EA? There. You can't, you don't see nausea until it turns to what? Vomiting. That you can see and measure. But nausea itself, you're like, I feel nauseous. Oh, do you? Do you know? You can't always, that in itself you can't see. What do you think a sign that is? If symptoms are subjective characteristics, objective characteristics. Yeah. Disease. We can measure body temperature. What else can we see or measure? Blood pressure? Blood sugar? There's blood sugar. What else? Yep, respiratory rate. I'm shortening all these. I think those are all the big ones. Yes, it's like, it's all the vitals. Those are generally objective. And then you ask, okay, all the subject, any nausea, any pain anywhere? Because these are things you can't measure, but it's still all characteristics of certain diseases. So when you go to the doctor and they're like, oh, I want to know all your signs and symptoms, and you just start rattling stuff off, hopefully you're hitting all of the subjective and the objective. But again, things that they can see. And again, we can see fever, well, measure fever, but again, vomiting, weight loss, you can measure. I mean, if you can see it or if you can measure it, it's considered objective. Now, syndrome is considered all the signs and symptoms that characterize a disease. So a syndrome are all the signs and symptoms that characterize any particular disease. A lot of signs and symptoms that characterize diseases, though. So if I say, okay, what is the syndrome for COVID? Well, what are all the signs and symptoms that characterize a disease? We run into issues because different people experience different signs and symptoms for certain diseases. It would be great if every disease had the exact same signs and symptoms for every single person that it infected. Then we just did WebMD and you type in your signs and symptoms and it would spit out a diagnosis. But diseases act on different areas in the body and different people in the body. Again, part of it is the disease, part of it is how many areas in the body it can infect, part of it is what's the immune response, well, maybe it was the infectious dose was different. There's lots of things that can change the syndrome. But again, it's where we start to get our first, what the heck is going on with the patient. Then there's also something known as asymptomatic or subclinical, meaning, I'm not going to write the word up there, but asymptomatic or subclinical is there are no symptoms, hence asymptomatic, no symptoms, but signs are present. Which means you might not even realize that you are sick because you're not outward exhibiting any symptoms or sometimes even signs, but there are signs. A big example is that you might not realize that you're sick, but if we did a blood draw and we would look at your white blood cell count, your white blood cell is elevated. It's fighting an infection. That's considered subclinical. It's like we got to get down into the clinical level before we actually start to see that there are signs present. So outwardly you may be asymptomatic, but there are signs that show that you are fighting some type of infection. Now, the studying of diseases. So etiology is the study of the cause of disease. Again, we are very fortunate. We know most of this. We know the different bacteria and what diseases it causes. But before, as we just started to realize that bacteria existed, and when we just finally realized that viruses existed, we had a lot of work to do. And etiology is looking at what organism causes what disease. Now, originally, before we had microscopes and we didn't know about all of this, we just called it the germ theory. We knew there was something that we couldn't see that would cause disease. So the germ theory of disease, there are some pathogenic disease-causing organisms that cause disease. Koch was the one that came up with his Koch's postulates on that history of microbiology worksheet you guys did weeks ago already, came up with Koch's postulates. He's the one that figured out, okay, how can we confirm that this organism truly causes this disease? And on the worksheet, you wrote it out, but here are the Koch's postulates that the organism, to say that this organism causes this disease, the organism has to be found in all cases of the disease. So if we're looking at tuberculosis, the bacteria that causes tuberculosis, if I want to know that that very specific bacteria causes the disease of tuberculosis, that organism has to be found in all cases of the disease, which means if we've got 10 people that came to the doctor's office, they all had tuberculosis, but we only found that one bacteria we suspect in like 2 patients, then that's not the bacteria that's causing that particular disease. It means everyone that has tuberculosis all better have that particular bacteria. We then have to isolate that bacteria and grow it up in a lab. And again, when we take samples from patients, like even you guys has lots of different organisms. That's why we streak plates out to try to get isolated colonies. But we have to isolate that particular bacteria and then grow it up in a pure culture. Meaning, I want to isolate, get rid of all the other bacteria that we know is growing in the body, and I want to find just that one bacteria that causes tuberculosis. And I'm going to grow it up. We're going to pretend that's the bacteria, it's growing red. And I'm going to put it into another organism, and it had better cause that same disease. Meaning, if this is the bacteria that causes tuberculosis and I give it to this mouse, that mouse had better develop tuberculosis, if that truly is the bacteria that causes this particular disease. Some issues. Even if you're just looking at it, you're like, well, this doesn't always seem right, because this is the Koch's postulates on how do we know what organism causes what disease. There were some issues. We couldn't do this for every single disease out there. One, because some organisms we can't grow in a lab. How do we isolate it and grow it in a lab and then infect someone else when not everything can get grown in a lab? Again, we haven't found the correct media yet. We haven't been able to figure out the correct environment to grow in a lab. And if you can't grow in a lab, well, you can't go through Koch's postulates and infect someone else, but that doesn't mean it doesn't cause that certain disease. Some disease isn't just that one organism itself for it to cause disease. There has to be a combination of things that have to occur. It might be two different organisms have to be present together, or maybe the person has to be immunocompromised. So it doesn't mean that bacteria that causes tuberculosis, I gave it to this patient and they didn't get it. Well, maybe the patient had a really awesome immune system. Maybe there has to be some other type of characteristic that allows it to cause disease. We'll talk about a couple viruses later where one virus all by itself won't cause disease unless you also have another virus in your body. It requires the other virus for it to the first one to cause disease. And then there's ethical considerations. I don't know, you're going to kill a lot of animals. In lab studies, you kill animals before we start to use humans as test subjects. But I don't know how many people are going to volunteer themselves to be like, please give me the bacteria you think is going to cause tuberculosis. I'd love to find out if it will do that. Or here, please give me some Ebola. I would love to find out if that's what this particular virus causes. There's ethical considerations when you have to run through these postulates as well. But it's a good starting point. It's a good basic idea of how can we start to narrow down what organism caused what disease. And again, we've figured out most of this already, but there are new viruses and new strains of bacteria all the time as things are mutating. Now, how do pathogens actually cause infection? So, again, more terms. One, pathogenicity just means an organism has the ability to cause disease. Not every microbe out there has the ability to cause disease. We generally don't care about them in this class then if they don't cause disease. But not every organism out there has the ability to cause disease. If it doesn't have a capsule, if it doesn't have some other thing that, our immune system can't fight off. So we have to look at, does an organism have the ability to cause disease? If it doesn't, we don't care about it in this class. And virulence of a particular organism. Virulence meaning to what degree of disease does it cause? There are some organisms that are very virulent, very likely and easily able to cause disease. Maybe it's because they have a really low infectious dose. Maybe it's because they've got a whole bunch of things that just destroy the immune system. Some produce toxins that kill us. What are things that allow them to cause disease? Examples of things that allow organisms to cause disease. One, do they have adhesion factors? Do they have things that allow them to stick to our cells? We already talked about that. If you removed the adhesion factors, if the bacteria can't stick, if the virus can't stick, it can't cause disease. So if they have adhesion factors, they are more likely to cause disease. If they can form biofilms, so if that organism can stick to cells, if it can stick to other bacteria, strength in numbers, more likely to cause disease. We've already talked about biofilms too. The next 3 slides talk about these virulence factors. If an organism can produce certain types of enzymes, they are more likely to cause disease. If they produce toxins, they're more likely to cause disease and damage to the body. If they can produce antiphagocytic factors, they're more likely to cause disease because that means the immune system can't eat them and get rid of them. Now, my question though is, so if virulence factors are things that allow it more likely for that organism to cause disease, how many virulence factors do you think your normal flora, like your skin bacteria, have? A lot or a little? A little. Your normal flora bacteria generally don't cause disease. They don't have a lot of virulence factors. They don't have things that are trying to, enzymes to try to degrade our skin down. They don't produce lots of toxins damaging their skin. They don't have a lot of virulence factors. They generally don't cause disease. So there's my one more slide before I get to my other things. The relative virulence of microorganisms, this is just showing things that are examples of things that are super likely to cause disease versus things that generally don't cause disease. So more virulent, more likely to cause disease, less virulent, less likely to cause disease. Rabbit fever, Francisella, we'll talk about it when we get to that bacteria. It's extremely virulent. One of its big virulence factors, it has an infectious dose of 1. And I'm like, which is a really low infectious dose, which just means one bacteria gets in the body and it will cause this, and it causes a very extreme fever that can be deadly if left untreated. Yersinia pestis, this is the bacteria that causes the plague. It has multiple virulence factors, so it's very likely to cause disease, and it's very deadly, which is a really bad combination. Otherwise, you start getting whooping cough, also very likely to cause disease, and depending on the individual, can be deadly. When you start getting less virulent, lactobacilli, this is the bacteria that can be found in some of the strains that make your yogurt, not likely to cause disease. Candida albicans, that's the yeast that you guys saw in the lab that you drew. Again, it's not likely to cause disease. It has less virulence factors. Doesn't mean it can't in certain situations, but it's less likely to cause disease. Now, some of those other virulence factors, the one, extracellular enzymes. So can the organism secrete certain enzymes? And extracellular means makes the enzyme and then it secretes it outside of the cell, extracellular. So it's secreted by the pathogen, and depending on what kind of enzyme it is, it could dissolve structural chemicals in the body. It could start to kill and destroy cells. It allows it to maintain its infection, allows it to get inside the body past that first line of defense, whether mucous membranes or skin. This is showing an example. Here's our epithelial cells. So this could be the mucous membranes that line, say, the respiratory tract. Our epithelial cells, great barrier. Here's the bacteria. They want to get in. In theory, they can't. But this particular bacteria secretes an enzyme called hyaluronidase. Again, it's an enzyme endogenase. And that particular enzyme, along with another enzyme that it makes called collagenase, breaks down the things that hold our epithelial cells together. And if our epithelial cells can't be held together, they come apart. Now you have an opening, and bacteria can get in. And so they can secrete certain things to kind of break down our cells to get in. Another example, this particular bacteria makes an enzyme called coagulase. What do you think of when you think of coagulating? Clotting. And that can be really good for bacteria. Some bacteria can make the enzyme coagulase, and it can cause a clot to form in the body, which again, can, depending on how big the clot is, bad for us. But the bacteria can actually hide inside of a clot. And your immune system doesn't see them then. And if your immune system can't see the bacteria, it's not going to fight them off because they're hiding in a clot. So it allows them to evade our immune system. Eventually, they're going to have to break down that clot, and they can make another enzyme. But now they've grown and divided, and it can go other places and causes infections. Other virulence factors, I wrote stuff in there, you don't feel like you have to write every word down. Other virulence factors are, can the bacteria make certain types of toxins? And again, a toxin is just any chemical that harms tissues, triggers our immune system. You don't have to write every word for word. Exotoxin means it's secreted outside. Endotoxin means it's secreted inside. An example of an exotoxin, so it's secreted and released by the microbe, usually to attack or kill a cell. So it's purposely secreted outward to do some type of damage. So this is showing an example. Here's a bacteria that wants to get past this cell. Again, these could be our skin cells. These could be cells of the mucous membrane. It could secrete toxins, and those toxins start to kill cells, and eventually, again, the bacteria are now invading our body. An endotoxin is a toxin the bacteria makes, but it doesn't secrete it outside the cell. It's just a toxin that it has or makes. My most common example that I put up there is our gram-negative bacteria. They have two membranes, and in the outer membrane, they have an endotoxin called lipid A. That is an endotoxin. It's there. It's not secreting and releasing it. It's just there. And when our cells start to break down bacteria that are gram-negative, that's when the endotoxin can then get released. The bacteria don't release it. Our cells release the toxin. And so when you have a gram-negative bacteria infection and your immune system is doing what it's supposed to do, and it starts to kill those cells, that endotoxin can get released and cause damage. And again, it's the toxin that can kill you, not the bacteria. And then the last virulence factor, and this will be my last slide, I think, yeah, are antiphagocytic factors. Again, anything that can just stop from the bacteria from being eaten. The first we've already talked about is if a bacteria can make a capsule. If a bacteria can make a capsule, it hides itself from our immune system. It can't get eaten. It allows it to survive. Again, and if the bacteria survives, it's good for it, bad for us. So this is showing an example. Here's a bacteria that makes a capsule. Even though here's one of our big white blood cells that's trying to eat it, sometimes it's a little too slippery. It can't get around it. Sometimes it just doesn't see it at all. And then some make chemicals that even if it does get eaten by a phagocyte, which just means an eating cell, even if it does get eaten, it makes a chemical that it can't get broken down. And that's real sneaky for a bacteria. We'll talk about some of the bacteria that can do this. So a phagocyte ate the bacteria, but this bacteria makes a chemical that it can't get broken down. Specifically, this one means the lysosome can't fuse. The lysosome breaks stuff down with enzymes. They don't all work the same way. But if it can't get broken down inside the white blood cell, what a great place to hide. If you can hide in an immune system cell, awesome. Your immune system cell now going to recognize the other immune system cells are infected. It can. It takes longer, which is good for the bacteria because in that time frame, it will do what it does best and it starts to reproduce. That's where I'm going to end. Great, because this class goes. Well, I got like 5 minutes, but I'm not going to start the next slide. Never remember what time this class goes till. But I wanted a couple minutes just to go over what is due.